Radiation is energy that comes from a source and travels through space at the speed of light. This energy has an electric field and a magnetic field associated with it, and has wave-like properties. It also can be called as radiation electromagnetic waves. At the Institute of Energy Technology at Kjeller, an accident occurred in a unit using gamma radiation from a 6OCO source for sterilizing medical equipment. An employee received a dose calculated to be in excess of 20 GY bracket 2,8 bracket and died 13 days later. The patient was a man born in 1917 who had suffered from a moderate hypertension and angina pectoris for the last couple of years. He used warfarin and propranolol daily and nitroglycerin on demand. He had his daily work in the unit using gamma radiation for sterilizing medical equipment. In the morning of September 2, 1982, he entered the sterilizing room in the belief that the radiation was turned off. He became ill after a few minutes in the sterilizing room with moderate chest pain. A doctor considered myocardial infarction and admitted him to an intensive care unit. A few hours after admission, it was discovered that the automatic lock and warning lamp of the sterilizing room were defective. It was considered almost certain that the patient had been exposed to gamma radiation at the time when he had become ill in the sterilizing room. The patient carried a film dosimeter, which unfortunately was damaged and the film was therefore rendered useless during development. The day after the accident, myocardial infarction could be ruled out and the patient was transferred to the section of hematology. A detailed evaluation of the causes of the accident is found in a report from the National Institute of Radiation Hygiene. During the first day, the severity of the radiation accident was not known. A rapid fall in circulating lymphocyte and granulocyte during the first few days indicated that the dosage of radiation had been large.
Cytologic analysis of lymphocytes cultured from blood drawn 24 hours after the accident showed extensive chromosomal damage and virtually no undamaged cells were found. Electron spin resonance spectroscopy of radiation-induced radicals of sugar components was done on nitroglycerin tablets carried on the patients in a trouser pocket. The results indicated a radiation dose in the tablet of some 40 GY. The patient was isolated in the section of hematology. The temperature curve and the blood counts after the accident are shown in the figure. When the patient became febrile, antibiotic treatment was started with penicillin and gentamicin. Partial gut sterilization was done with neomycin and nystatin. The patient also received granulocyte concentrates 8, 9, and 12 days after the accident, respectively. Early in the morning of September 15, which is 13 days after the accident, the diuresis deceased rapidly and anuria ensued. 8 a.m. The blood pressure at the time was 115,000 and 175. The patient was drowsy and died rather abruptly at 10:45 a.m.
Showed the bone marrow to be markedly hypocellular with a few scattered plasma cells. Lymph nodes were hypocellular. The spleen was somewhat enlarged due to congestion and hemorrhage. There were only remnants of follicles and evidence of cell destruction with many nuclear fragments. The mucosa of the gastrointestinal and respiratory tract showed only a few mononuclear cells and no granulocytes. There was slight atrophy of glands in the stomach, marked atrophy in the small intestine, and total atrophy of the glands in the large intestine. The villi in the small intestine were not atrophied. The kidneys were enlarged, and microscopy showed more interstitial edema and hyaline case in the tubule. The left ventricle was hypertrophied, and the anterior descending ramus of the coronary artery was markedly stenotic. An old anterolateral infarct was found in the corresponding area of the myocardium. A committee was appointed to evaluate the radiation dose received by the patient and concluded that since the dose in the nitroglycerin tablets in the trouser pocket was about 40 gray, the mean total body dose was considered to have been 22 plus minus 2 gray. The mean bone marrow dose 21 plus minus 2 gray, and the mean dose in the brain 14 plus minus 2 gray. It was considered that the spin resonance spectroscopy provided a rather reliable method for dose estimation. The increase in chromosome damage was quite well correlated with an absorbed dose up to around 10 gray. Chromosome analyses are of less value for estimating radiation doses above 10 gray. We consider that the results of the chromosome analysis in this patient were not incompatible with the results of the physical measurement. The patient did not have symptoms related to brain radiation injury. It seems likely that the calculated dose in the head of about 14 gray is compatible with the absence of manifest symptoms of radiation injury to the central nervous system. The autopsy findings in the gastrointestinal tract were less marked than we had expected from other reports in the literature. The patient had a diuresis of more than 1,800 ml per day until 12 per half days after the accident. From the 11th day after the accident, the serum creatinine started increasing, and the last few hours before death, the patient had oliguria to anuria without hypotension. Autopsy showed considerable interstitial edema and hyaline case in the tubule. Similar renal symptoms and autopsy findings have previously not been reported after radiation accident. Everything shown here is true, and after all, please be careful when handling equipment in laboratory or in workplace.